You can see this girl, and like her, there are many around us, and her only problem is kya karu. Obesity has become a growing concern for Bharat. Facts and figures, how it harms people around, and strategies to have lasting improvement. Majority of the strategies are the ones which may be there in paper, but our officials are such that they do not monitor. So we are you know increasing in size. एक particular age आती है, height नहीं बढ़ सकती, तो फिर चौड़ा ही होना पड़ेगा. Now, World Obesity Day is 4th March, and it ensures that everybody who celebrates this particular day ensures happiness, healthiness, longer lives for people all over the world. This particular slide has been circulated by Dr. Shama Batra, and speaks by itself what all it does. This is the spectrum of problems which are related to obesity. Mainly is कि आपका जो cardiovascular diseases है, इसका बटन बीप करने लगता है. हमारे जो joints हैं वो 50 किलो के लिए बने. So if you put too much of weight, there'll be joints बैठेगा. Then problem is there of type 2 diabetes, fatty liver, hyperlipidemia, and obstructive sleep apnea. There are many others. List is unending. And this lady says, in the first photograph, she said, "Kya karu?" And she says, "I'm hopeful. There's so many things I can do." Obesity, commonly referred to as mutapa in Hindi, and has emerged as a significant health concern in India. Time has come that we all give up. एक सेंटेंस बोलते हैं, खाते पीते घर के हैं. जब भी आप मोटापा देखोगे, ये खाते पीते घर के हैं. This we have to give up. The increasing prevalence of obesity poses substantial challenges to public health, economic productivity of the country, and overall quality of life. In this presentation, I'm going to just speak about 30 evidence-based points detailing the current statistics associated with health risks and strategies intervention to combat obesity in Bharat. Now, current criteria, statistics on obesity in India. On 16 January 2025, the government of India has added that along with BMI, we have to add waist, one of the criteria for obesity. And you can see here, earlier we used to say, जो भी BMI Western world का है, उसमें 2.5 घटा दीजिए हर कैटेगरी के लिए. तो right BMI for we India and for Southeast Asia आपको आ जाएगी. अब वो कहते हैं नहीं, waist भी बहुत जरूरी है. Rightly, waist should be half of the height in inches. And the cutoff given by the government of India is female it is 80 and male it is 90 centimeter. याद कर लीजिए. As for the metros in this particular countries are concerned, and if we consider people who are 18 plus, obesity makes people physically unfit. In women, when the overweight and obesity are combined together, it is close to 60% versus 40% in men. You can see the figures. In 90, there were 3 crores, and now in 24, there are 35 crores. Sedentary lifestyle. बैठे रहते सोफा में 85, then it becomes 95, it becomes 120, and then there'll be more. Now this is a projection comparing 90 figures to 2040. It's strictly talking of obesity, more than 30 BMI. 90, it was 12% for women and 8% for man. And 2040, it is expected it will be 28% in women and 23% in men. We're talking about BMI more than 30. Prevalence of overweight is whenever the BMI is more than 23, more than 27, it is obesity, and significant morbid obesity is BMI 30. Among Indian women increased, and I think, from today onwards, people who are not doing it, that every time the patient comes to your clinic, her weight must be taken 5 minutes after, she comes. The blood pressure should be taken, put a pulse oximeter, take a pulse. Pulse will be checked by the BP apparatus as well as in the pulse oximeter, and then oxygen saturation. It should be done for each and everybody. And at my clinic, not only we take height at that particular time, we also take the waist. It has become a routine with our staff that they do it themselves. Once it is done, then people become obsessed about things. And you can see here the incidence in 2016 was 21%, and it rose to 24%, and in 25% in 2025 for women. And as for the men are concerned, it is approximately 23%. I again repeat, the waist should be half the height. Approximately 40% of the Indian women and 12% of men are abdominally obese. Handiya wala pet. The higher rates observed in southern India, it was surprising to me. I thought Kerala is the healthiest. And you find that the waist of Keralite woman is 65 plus. Tamil Nadu, it is 60%. And in North India, Punjab, it is 63%. In Delhi, it is 60%. So, bड़ी progress हो रही है ladies में. Urban versus rural divide, you can see obesity rates are higher in urban areas compared to the rural areas. And this is because of the sedentary lifestyle and increased consumption of processed foods. एक कोकोनट की कुकी है ना, वो एक पराठे के बराबर है. So every time when you take cookie, you must remember, Madam has said it is equal to hasta paratha. Gender disparities, you all know already. Women exhibit high obesity rather than men, potentially due to cultural practices, hormonal factors, and limited physical activity in comparison to men. As far as childhood obesity is concerned, we have approximately 15 million children in India who are overweight, and the Bharat is second globally in terms of childhood obesity. Second. सब जगह हिंदुस्तान ने झंडे गाड़े हुए. As for the socio-economic factors are concerned, higher income levels are associated with increased obesity rates, likely due to lifestyle changes and dietary patterns. Today I was seeing on the TV, Anil Ambani has been projected in all the TV channels that he is going to march from Jamnagar to Dwarka. And he's taking all crowds along with him because उससे तो अकेले तो पैदल चला नहीं जाएगा, सब crowd चलेंगी तो वो 3 घंटा सुबह चलता है. And probably he's aspiring to become MP from Gujarat, and that's why he's taking away all the crowd along with him. कुछ भी करे अच्छा है. Health risks associated with obesity, I think I don't have to tell you to this August gathering, they all know about it. Cardiovascular disease, it significantly increases the risk of heart disease, including hypertension, coronary artery disease, and stroke. Type 2 diabetes, fatty liver comes first and the type 2 diabetes comes later. Excess body weight is a leading risk factor for developing type 2 diabetes, with India already being termed as the diabetic capital of the world. As for the musculoskeletal disorders are concerned, it leads to osteoarthritis due to increased stress on joints. And I always repeat, the joints are made for 50 kg people. And if you put more weight, they will break. As for the cancers are concerned, higher body fat is linked to an increased risk of cancers such as breast, colon, and endometrial cancer. And in people who are morbidly obesity, this cancer risk increases 5 to 6 times more than the general population. As for the respiratory issues are concerned, obesity can lead to sleep apnea and other breathing problems. You'll be surprised to know that 10 to 12% of people require aids in the night to sleep. As far as mental health is concerned, friends bully them a lot, and there's a correlation between obesity and mental health disorders, including depression, anxiety. आप सोसाइटी को अवॉइड करते हो, घर में बैठते हो और खाते हो. Reproductive health. Obesity can cause infertility and complications during pregnancy. All of you know very well about that. Fatty liver disease, excess weight increases the risk of non-alcoholic fatty liver disease, potentially leading to liver failure. So I will say that wake up India to fatty liver. Fatty liver precedes diabetes. As for the metabolic syndrome is concerned, as you all know about it, that non-communicable disease are responsible for 65% of the total deaths in our country. 65% of total deaths in the country, and these 65% of the total deaths are all preventable. Obesity is a central component of metabolic syndrome, increasing the risk of cardiovascular diseases and diabetes. It is a reversible process. As for the gallbladder disease is concerned, there's a higher incidence of gallstones in obese people. Kidney disease, chronic kidney disease, is entity by self because it's increasing day by day, and it is seen more in obese people. This should wake you up. Severe obesity can reduce life expectancy by good 10 years. Good 10 years. And for the long-term strategies to combat obesity are create awareness, awareness, and awareness. और ये कहना बंद कर दें कि खाते पीते घर के लोग हैं ये. Policy of eating traditional diet has to be revived, and I think this has to be taught to every child in the school. कि उनको क्या खाना चाहिए, और ये बात उनको जितनी जल्दी समझ आ जाए उतना ही अच्छा है. The answer to kya khaye by me is that you should take home food and no food from outside. Policy of diet intervention to all students, college goers, workplace canteens, Eat Right India. Government of India has started this particular program in 2018 that every child should know, every family should know what to eat, what is right for them. Implement seriously nutritional policies of the Government of India. Marketing of unhealthy food, especially to the children in the schools and to the members in the colleges, has to be strictly followed. Bazaar mein, we must regulate the marketing of unhealthy food, especially implement कि उनके पैकेज में बाहर लिखा होना चाहिए कि what they are consuming. Implement seriously nutritional policies. होटल में, मोटल में, पेस्ट्री की शॉप पे सब जगह लिखा होना चाहिए आप क्या खा रहे हो. What is the nutritional values and what is the total calories which you're buying and eating. It should be informed to the consumers. बाहर के देशों में होता तो हमारे में क्या परेशानी है. Eat Right India, the Government of India should become serious on nutritional policies. Here I just wish to tell you, when the black and white TV had just started in 1968 in China, Mao came on black and white TV and told the Chinese people, no more Chinese food for the Chinese people. अगर आप खाना चेंज नहीं करोगे तो मेरे तरह से ठिगने रह जाओगे. And you can see now that 70% of their population is more than 6 feet. So this has to be learned from the positive leadership. What do they want? We must inform public about unhealthy food items, refined wheat, मैदा, refined oils. ये सबसे बड़ा पुण्य का काम होगा. नवरात्रि के दिनों में कोई भी त्योहार है उसमें प्रण करिए कि ये वाला काम मैं करूंगी. The other day I saw Narendra Modi on the TV. For 20 minutes he only talked only one thing. He said ये सबसे बड़ा दुश्मन है भारतीय फैमिली का. Average family of 4, according to him, consumes 8 liters of oil. And every person that, by this, it means 2 liters of oil is being consumed. And he said, the right way will be consume half. 2 liter खाने के बदले 1 liter per person per month होना चाहिए. आप लोगों ने सब देख लिया ये बोतलें? जो स्वादिष्ट है वो अनहेल्दी है, ये याद रखिए. जिसमें भी आप कहते हैं यार बड़ा स्वाद है, उसमें आप मान के चलिए वो अनहेल्दी है. When we say eat right India, we all know about the malnutrition rates among women and girls are concerning to us. But to rectify them does not mean that we must stop cooking at home and start eating outside. We must know what is unhealthy and what is good for us. We must एक्टिव ट्रांसपोर्टेशन का रूल होना चाहिए अपने लिए. वॉकिंग करो, साइकिलिंग करो, पब्लिक ट्रांसपोर्ट यूज करो. This should be encouraged for one and all. Salt. Again, biggest problem. एक चाय का चम्मच फ्लैट नमक आना चाहिए उसमें. और अगर आप हाइपरटेंसिव हैं, आपकी फैमिली हाइपरटेंसिव है, तो उस फ्लैट चाय के चम्मच पे जो सॉल्ट है उससे भी आपको कम करना चाहिए 3 grams. तो इसको सोचिए, इसमें मनन करिए क्या क्या चीज में कम कर सकती हूँ. चटनी, चाट, अचार, दही में, दिस थिंग, सैलेड में सॉल्ट, ये सब बंद करना चाहिए. नो एक्स्ट्रा सॉल्ट. दाल सब्जी में जरूरी है, बस उसको लीजिए. How much water should we eat? It should be around 2.5 to 3 liters per day. My suggestion to you will be no cold water. You go to any parts of China, no cold water is served anywhere. आपका जो पब्लिक प्लेसेस में भी जो पानी निकलता है वो गर्म पानी निकलता है. So they must have some merit into it in this lukewarm water or hot water. I can say from my own experience that if you take relatively hot water in the morning, it will clear all your gut. Again, promise no aerated or fuzzy drinks. You can make a simple and alkaline water. एक ग्लास की बोतल लीजिए 1 लीटर की, उसमें 2 स्लाइस आपने खीरे के डालने और 2 पत्ती पुदीने की और 2 पत्ती तुलसी की डालिए. Use this 1 liter water and this will do you good for the first 1/3 of the day. Now, what is the easiest way to prevent obesity? Plate method. Fill half of your plate with vegetables, 1/4 with protein and 1/4 with मोटा अनाज से. और प्लेट भी छोटी लो. जापानीज का रूल फॉलो करो, 80% रूल. जब ये लगे कि यार पेट फुल हो गया, डोंट टेक एक्स्ट्रा, क्योंकि ये स्वादिष्ट खाना है. एंड प्रॉमिस टू योरसेल्फ 10,000 steps a day or a minimum 30 minutes of activity. And people who are 60 plus, 5,000 भी steps आपके लिए बहुत अच्छे. How much oil to be consumed? Theoretically speaking, 30 grams per day, 1 kg per month per person. And how much India is consuming? 20 kg we are using it. And we have to bring it down to 12 kg per person per year. I'm sure my subsequent people will talk about which oil to use. Otherwise, in question and answer, we'll settle it. How does obesity impact women's health? Polycystic ovarian disease is causing an epidemic. Infertility, diabetes, heart disease, joint pain, mental health issues. I'll speak again about mental health issues. These people shy away from public. When they sit back at home, they eat more. So, बद से बदतर होते जा रहे हैं. How much protein you should take? 1 gram per kg for an adult. So if you're 50 kg, then you should take 50 grams of protein. Adolescent is a growing age, 1.5 gram. Pregnancy is, again, requires 1.5 gram per kg. What are the top 5 foods Indian foods should eat daily? People should take nuts and seeds, 5 badam subeh, and people who are 70 plus, you should take 5 almonds even in the evening again. Flax seeds are poor quality of omega-3 fatty acid they give. People who cannot take fish oil as omega-3 fatty acids have no other choice but to go for flax seeds. Green leafy vegetables for iron and calcium and for a lot of vitamins it has. I will again vouch for if people who can give away the eggs, usko vegetable ही समझना चाहिए. And if you take 2 eggs per day, then I think all your problems can be sorted out. Otherwise, the alternatives are there as paneer and tofu. Dal and legumes are no inferior than non-vegetarian food. I am very fond of chilke wali moong ki dal, and I say 100 grams of moong ki dal is equal to 8 white of eggs. So, very promising. इसका जो पचने का समय है वो भी 2.5 घंटे, just like fruits. Dairy or alternatives for bone health. Many people in the Western world say no dairy products. People like me say that it can be taken unless you have problem of, polycystic ovarian disease and other things. Fruits are definitely needed for vitamin C, for immunity, and for iron absorption. This need to be remembered by each one of you. Green leafy vegetables are supposed to be 1 gram per kg is Ayurvedic dawa for you. And if you have not followed so far, please follow it from today. What are the top 5 foods, Indian foods, we should eat daily? ये तो हो गया आपका. That's it, done. रोटी चावल पर निर्भरता छोड़ देना चाहिए. 5 साल पे ये अकल आ जानी चाहिए कि इसको थोड़ा कम खाना है. 60 साल पे अगर ये अकल आ जाए तो हम कहेंगे बहुत अच्छा. 70 साल पे तो बहुत ही जरूरी है कि दाल चावल नहीं, आपके रोटी और चावल जो है जितना भी कम कर सकेंगे अच्छा रहेगा. There was an international conference in Manchester in January this year, and in every hall there was a big board was put up. Indian dal chawal is the best combination. Imbibe. Indian khichdi se pyar kar lijiye. It contains everything, provided you add little vegetables in it. 2 proteins को एक साथ नहीं लेना. We can talk on it later. Why should women avoid processed foods? Because of increased risk of diabetes, obesity, heart disease, and cancer. How can women improve gut health? No outside food. Probiotic foods like curd, buttermilk, kanzi. Fiber-rich diets like fruits, vegetables, and whole grains, and avoid trans fat. तला हुआ खाना, बार-बार एक ही तेल में तला हुआ. This all trans fat. It knocks your testes, it knocks your ovary, it decreases your AMH, and you are left कि डॉक्टर साहब मेरी तो उम्र अभी 28 साल है, मेरा AMH कैसे हो गया? And this is what it is outside food does. Why do women need vitamin B12? To prevent weakness, to prevent memory loss, nerve problems, and you all know about the macrocytic anemia. People like me believe that we must tax unhealthy foods, implement taxes on sugar-sweetened beverages and junk food to reduce consumption. I think, in my lifetime, I will never forget Ramdev Baba ki kranti on cola drinks. I think, 80% of the Indians have gone away from cola drinks. This contribution by him will be always remembered. Request comes from WHO subsidize healthy foods. Already government is giving free grains and free other things to 80 crores of this particular country. Of fruits, vegetables and whole grains भी देना शुरू कर देंगे इसके अलावा. तो सरकार क्या क्या करेगी? So I think we need to be realistic. Create supportive environment. ensure access to safe recreational places and facilities where children can play, where the adults can play, and even the elders like me can go and walk about. Healthy interventions, regular monitoring is required. Incorporate routine BMI, waist circumference measurements, hemoglobin in your day-to-day clinic practice. Because of my sister illness, I happened to go 2-3 times to the general hospitals. I was surprised that people don't get up from their table. बस टेबल में बैठकर आपसे सवाल पूछ लेते हैं और दवाई लिख देते हैं. This particular thing must be curbed. People who are teachers, senior residents who are listening me should do this. हम इतनी हराम की तनख्वाह खाते हैं तो कुछ तो करना ही पड़ेगा. They're supposed to enter in the hospital at 8 o'clock and they walk in at 10 o'clock. This can't go on like this. I think this must be remembered by each and everybody that girl hemoglobin should be 12 grams per cent, and this I say after 2 years till the time she dies. And for boy, it should be 13 grams at 12 years and till the time he dies. Training healthcare professional is very important. Equip healthcare doctors and nurses to provide with skills to counsel patients on nutrition. We are not taught ABC of nutrition in undergraduation, and that's why the doctors are very poor in nutrition. Physical activity, we must tell, we do it ourselves, and we must speak the same to our people. And that will bring out the behavior change. Behavior change has to be brought about for home food and no outside food. Develop weight management programs. Teach it to the adolescents. They can earn money because of this, by teaching to the other people. Establish community-based programs focusing on diet, exercise, and behavioral therapy. Each adolescent must learn yoga and again teach to the people who do not know yoga, and they can make pocket money out of it. Intermittent diet is great. That means 16 hours of fasting and 8 hours of eating. And by this particular process, after 12 hours of fasting, brings the body to autophagy. And then you discard all the things which have collected in your system. If you can't do this 16 hours fasting, do minimum 12 hours. शाम को 7 बजे से सुबह के 7 बजे तक मत खाइए. ये बहुत सारे लोगों की आदत है कि दोपहर रात को उठकर खाते हैं, वो गिव अप कर दीजिए. Integrate technology, utilize mobile health applications to provide personalized guidance and monitor progress. I was amazed to Piyush Goyal yesterday was talking to all these startups, and he says, look at China and look at US where the startups are going. हिंदुस्तान में खाली एक startups हैं कि वो आइसक्रीम बनाते हैं और लोगों को बरगला के बोलते हैं कि ये डाइट आइसक्रीम है और इस तरह की आइसक्रीम है. And we are making lakhs and lakhs of boys who just transfer this particular food to the rich people without waste of time. So this is not empowerment of the lower people who are getting exploited. Very well said by the minister. Educational and community-based interventions. School-based programs should incorporate nutrition and physical education into school curricula to instill healthy habits early. I visited a couple of schools in China, and you can say it, and in Tibet, right in the school itself, एक पूरा चक्कर लगवाते हर बच्चे का, वहीं पर सारी स्ट्रेचिंग एक्सरसाइज, प्राणायाम, आइज एक्सरसाइज सब कराते हैं. अगर वो कर सकते हैं तो हम क्यों नहीं कर सकते? Community engagement has to be there by organized community, college, school events should be done to promote active lifestyle and healthy eating. Public awareness campaigns launch a nationwide campaigns to educate the public about the risk of obesity and the benefits of a healthy lifestyle. So take-home motivating messages are Addressing obesity in India requires a multifaceted approach involving policy changes, healthcare interventions, and community engagements. By implementing these strategies, India can work towards reducing the prevalence of obesity and its associated health risk, ensuring a healthier future for its population. Thank you very much.